Is the first wave coming to an end in India? There is no spike nationally despite the festival season, winter, and large gatherings without masks, physical distancing. Though the total number of coronavirus cases in India has crossed 10 million, the number of daily fresh cases has been steadily dropping from a peak of nearly 98,000 cases on September 16 to the low of 25,000 daily cases in the last few days. December 25 recorded to 22,000 fresh cases. Steady drop in the cases has been seen nationally without much of a spike since the mid September, notwithstanding the festival season, winter, and large gatherings, whether political or otherwise. The absence of a spike is all more surprising as a strict and adherence to the non pharmaceutical interventions (NPIs) has been far from good. Does this mean the steadily declining trend in the daily cases and absence of a spike nationally then suggest that the first wave is slowly coming to an end in India? It would be inaccurate to infer at the national level. While some of the northeastern states have an cumulative test positivity rate above 8%, even at national level, the cumulative test positivity rate is 6.1% as on December 23, which suggests we are not near the end immediately. Dr. Giridhara Babu, Professor of Epidemiology at the Public Health Foundation of India, Bangalore, and member of Karnataka COVID-19 Technical Advisory Committee, says in an email, the cumulative test positivity rate should be less than 5% to say that the transmission has been contained. The reason 7 day of or month positivity rate only indicates active surge in the cases as seen now in some northeastern states, while the cumulative test positivity rate reflects the overall containment in the transmission. A note of caution. Gautam Menon, the professor of physics and biology at Ashoka University and co-author of COVID-19 modeling studies, cautions in email that test positivity in large in number of states, including Kerala and Maharashtra, which were hard hit earlier as well. This suggests that the disease is still pending, spreading all through more slowly. I think this is mainly evidence that COVID 19 is no longer primarily spreading in more urban areas, so this should be expected to mark a qualitative change. In that sense, it can be thought of an end to first wave, he says. The decline has been steady and prolonged, with fall somewhat slower than the rise. Within this fall, in national figures, there are small regional spikes, and that will continue to happen in the days to come, says virologist Dr. Shahid Jameel, director of Trivedi School of Biosciences at Ashoka University, explaining that natural infection, both detected and undetected, has not reached the level to confer herd immunity and cause a slowdown in daily cases. Dr. Menon says, my own guess would be that about 40 to 50% of urban India, in particular Tier 1 and Tier 2 cities, has been infected at this point, while an India-wide number is more likely in a range of 30 to 40%. This is still below what might be a herd immunity threshold. Although it would be consistent with a decrease in the number of daily cases as is being seen, Dr. Jameel too feels only about 30% of the people across India have been infected, while positivity is somewhere in the range of 50% in the large dense cities. It is hard to say if natural infection has come close to providing the herd immunity unless another more representative serosurvey is carried out. Reasonable explanation could be the only reasonable explanation for a drop in the daily cases without any spike even after the Durga Pooja and Diwali is that, besides other factors, the threshold for population immunity attributed to has been reached. Inefficient testing strategy, better compliance to regulations, or combination of these. Sufficient adherence. My only guess is that adherence to NPIs, although not ideal, was sufficient to slow down the spread, and the state governments did institute some reasonable measures to curb spread during the festivals. Certainly, anecdotal evidence suggests that although crowds did build up in the festival season, mask wearing was reasonably common, says Dr. Menon. The other possibility is that in regions which saw the largest crowds, as far as the example Kolkata's Durga Puja pandals, this was in the background of a large fraction of people with prior infections already, so this would have been hampered unrestricted spread, explaining why daily cases in Kerala are still high while other states including the Maharashtra, Tamil Nadu, Andhra Pradesh and Karnataka had earlier reported high number of cases have seen a sharp drop. Menon says, I would attribute this to the fact that spread in Kerala started somewhere later than the other regions, and the fact that the Kerala is fairly urbanized in comparison to most other states. Dr. Babu feels a sharp drop in Maharashtra and the three southern states in the most because of the reasonable proportion of people living in urban areas have been infected. He attributes the relatively high daily cases in Kerala to effective control of the virus spread from beginning. This meant that a large proportion of people in Kerala remained uninfected in the initial stages. It is supported by the zero report by the zero report uh, zero prevalence rate of 0.8%, which is much lower than other states. It meant getting infected some point, but explains tests done in Kerala are 2,08,000 per million and is among the state and is the states with the best rates. It is because that state is detecting more cases. Reporting more cases should not be seen as a problem. Though the number of cases appear to be dropping in three southern states, the test positivity rate is still above 5% as on December 23. The cumulative test positivity rate in Karnataka, Tamil Nadu and Andhra Pradesh is somewhere else 7%, 5.78% and 8% respectively. The only reasonable explanation is that, besides other factors, the threshold for population immunity has been reached. Inefficient testing strategy, better compliance to regulations, or combination of these can be the reason for the low daily cases.